This segment of Delmarva Life is brought to you by Peninsula Home Care.
Well, we've been recognizing breast cancer awareness this October by sharing the stories of brave survivors, by encouraging you to take that step and get your mammogram. We've told you about events that support the cause and have urged you to somehow, some way, get involved. Well, today we want to address the survivors, the brave women and even men who face the battle head on. We want to discuss the medical side of breast cancer and the care available for patients when they take the big and sometimes scary step of coming home from the hospital. And Christine Yingling is a registered nurse with Peninsula Home Care. Thank you so much for joining us this afternoon. Okay, so first of all, let's just start off with, for those who aren't familiar with Peninsula Home Care, you actually go into the home and give the care that people need.
You're coming from home from the hospital. If they need any education, wound care, we provide all that care for them. Physical therapy, occupational therapy.
Okay, and when it comes to breast cancer, you work a lot with patients and who are recovering from surgery or chemotherapy. You can help in both those situations? Tell me about it.
Nursing is mainly if they've had surgery. We help with the wound care, help with pain management, help them monitor for signs and symptoms or disease management. We also have occupational therapy that works with them. They help with controlling lymphedema. Energy conservation, helping them with being independent with their activities of daily living.
And you mentioned pain management. Tell me a little bit more about that.
It's mainly educating them on their pain medication and how to take it and when to take it. Getting up with the doctors if it's not enough pain medicine for them.
So you're really a liaison too for these people, and I imagine it's scary for them when you come home.
Definitely.
Yeah, so you're there to kind of ease, at least keep them calm about what to expect and what not to expect.
We're like their second lifeline between the doctor and them.
That's great. Okay, so PHC also provides in-home chemotherapy. I didn't even know that was possible. Tell me about that.
Mainly what happens is they go to the cancer center for their first treatment. They get hooked up to an infusion pump and they come home, and about 46 hours later we go out to the home and disconnect their chemotherapy.
And that has to be nice for the patients.
Yes, less going back and forth for them. It's very tiring. They go through a lot of symptoms while they're getting their chemotherapy.
And being in your own home makes it a lot more comforting?
Yes, yeah.
Okay. What do you do for the cancer patient? I mean, when you're there, you actually hook them up and everything with the chemo?
Well, actually, we disconnect them mainly. We do have a few chemos that can be hooked up, and we sit in the home during the infusion. Usually it's about a 2 to 3 hour infusion where we're there with them the whole time they're getting the chemotherapy.
Okay. And as a nurse and someone who visits these patients, do you see the relief when you come to visit them?
Yes, yes. They're so much more comfortable at home, being there with their family, not in that hospital setting that's a lot more stressful for them.
So it's very important. Christine, thank you so much. Good information. Good to know that we have that service out there. And if you would like to learn more about Peninsula Home Care, just go to our website, delmarvalife.com.